familiarity and use of stimulant medications in ADHD, I know I became much more willing and able to use them. Also, many pediatricians have no problem with stimulants, and I feel that that will also occur when the primary care network begins to treat ADHD more vigorously, diagnose it and treat it. One last thing is that the newer stimulants are really, the long-acting stimulants are the mainstay for our treatment. Unfortunately, we're still using too many short-acting stimulants today. ADHD is a very common illness, and in the primary care setting, it's unusual that you're not going to see at least 1 or 2 patients a day present. My comfort with treatment of ADHD comes from diagnosing it in my practice and knowing how beneficial the medications are.
I think it's important to manage ADHD as an adult or a child in a multimodal way. I take medication for my ADHD. I actually take 2 types of medication, but that's just a part of a multimodal approach. I run religiously to manage my ADHD. I employ a lot of coping mechanisms that I've developed over the years that work for me. They may not work for somebody else, but that was a process that I went through. I think the important thing to stress about medication is that it's not a cure for ADHD. When it works, it can be a very effective tool that helps people make positive changes in their life.
So I see perhaps 2 patients a day, and many times they come in with other illnesses masking the ADHD, emotional distress, major depression, etc. So I need to survey, I need to look, and I need to have a high index of suspicion. And there are screening tools which assist you in making this diagnosis. ADHD is second only to depression in its occurrence in the National Comorbidity Replication Survey by Kessler. That means that you're going to see many ADHD patients just as you see depressed patients. There was a paradigm shift back in 1989 and 90 in the primary care setting, where we began as primary care physicians to screen for and use medications we weren't familiar with, in particular the selective serotonin reuptake inhibitors. This is similar to that paradigm shift. We now have a very common undiagnosed, underdiagnosed illness that's causing all kinds of problems, both physically and emotionally, in our patients. The more you become familiarized and screen for this illness, the more you become familiarized with treating the illness. So I became comfortable by seeing the beneficial effects and the outcomes which were otherwise not going to occur in my ADHD patients. I think the 10 million people who have this disorder, 9 million of which are undiagnosed, really deserve for us to become familiarized not only with how to diagnose ADHD, but how to treat it.